PI for the Children with Medical Complexity CoIIN. And we, on behalf of the team, we wanted to say welcome to you all and thank you for joining us on a Friday afternoon during a time when there are lots of opportunities for learning. And some of those opportunities are more challenging than others. It's been a time to our state teams, to our National Advisory Committee members who have been able to join us today, to our collaborative partners, and to our partners at HRSA. We say welcome and thank you very much for your time. Thanks especially to our speakers, Deborah Waldron from the American Academy of Pediatrics, Tricia Calabrese from the American Academy of Pediatrics, and Dennis Quo, who is the chair of the AAP Council on Children with Disabilities. We're going to go ahead and turn over the agenda to them in just a second, but before that happens, we have to do our usual boilerplate housekeeping. Just really quickly, as you all know, the webinar is being recorded as always. After it finishes rendering, we will upload it to Box so that you all have access to it. Please don't use the speakerphone if you can possibly avoid that. Please don't put us on hold. Please mute your phone if you are on the phone when you're not speaking. Press the mute button on your handheld phone or press *6 to mute and *6 to unmute. If you're on the computer, please go ahead and mute yourself with the little microphone icon if you have been speaking and we've unmuted you. Otherwise, I think everybody except the speakers is on mute now anyway. Participation is essential, so as soon as we open up the lines to everyone, we're very, very much looking forward to having a dialogue with you all. We have some really outstanding speakers who are going to present for the first part of our webinar today, and then we're going to open it up to you all for conversation. If you have tech issues, please chat Libby in the chat box. If you have content questions or comments, please make sure that you've selected all participants. That would be really helpful so that we can all share in what you all have to say. And if you could, it makes it a lot easier for us to be able to mute and unmute people as needed if you link your phone with your computer. And to do that, these are the very quick instructions. You're going to go ahead and enter your participant ID when you call in. Bind your phone and computer session together by entering pound and your ID and then pound again on your phone. We're hopeful that this works for everyone. If it doesn't, though, it's not a disaster. We can always figure it out. One thing I think we've all been having the opportunity to do in the past 6 weeks or so is to become a lot more comfortable with Zoom. So, you know, stuff happens with Zoom, as we all know. So I'm going to go ahead and turn the floor over to Bethlyn now, who will walk us through our agenda. But again, thank you very much for taking the time to be with us, and we're looking forward to the discussion. Thanks, Bethlyn. It's all yours.
Great. Thank you, Meg. Thank you, everyone, for being here amidst such a crazy time on so many levels. I think that what we are hoping for with this pop-up webinar, we are very grateful for the speakers who are going to be able to just kind of help provide some frame and elevate some of the themes and the activities that have been happening around COVID-19 in relation to CMC. So as you'll see, the first, Deborah Waldron and Tricia Calabrese will speak about the American Academy of Pediatrics, their COVID-19 updates around what they've been doing and hearing. And what we're hoping is that in the context of that, and I'm also Dennis Quo being able to speak about the Council on Children with Disabilities and from their perspective, the ways that they've been feeding things back on the ground in pediatricians and what they're hearing and the role that they're playing, is that as we're going, these speakers have already, we've been talking about this, that we want this whole thing is really bring forth whatever is going on right now. So if they're talking and there's something that comes up on your mind, this is point of need conversation and discussion and sharing so that it can be immediate feedback to how you're able to support and we can together try to create more glue for the system that is is clearly the chasms that are just being exacerbated right now. So that's what we're going to do. So please do not hesitate to chat something in the chat box, and I will, I know that everyone has been prepped to be very understanding when I say, hey, excuse me for just 1 second. We do have one question about that or a comment. So we strongly encourage you to use this time so that it is of immediate benefit to you in whatever role you may have at this time. So we appreciate everyone who is involved in this. And then we're going to just open it up in any case for approximately the second half to anything that people would like to discuss, bring up, hear from each other. We have National Advisory Committee members that have of their own volition just chosen to be on this call as well. And we strongly encourage all of you that have joined. Just very grateful that everyone has such a wealth of expertise, knowledge, passion here amongst us to be able to infuse into this discussion and share together. And now, if ever, this is the time to be able to do that. So that's it. And then we're just going to try to do it like a literally 1-minute wrap up at the end with Ben Plant, and that's where we're at. So I'm going to hand it over to Deborah and Tricia. Thank you. And I'm not sure if we have Deborah yet, so Tricia may be starting us out.
Sure, I'm happy to do that. So hi everybody, I'm Tricia Calabrese. I'm a Senior Director of Pediatric Population Health at the AAP. I think if we can just go back, okay, there we go. So I'm going to talk to you just briefly about the AAP response to COVID-19. We can go to the next slide, please. I think, you know, right when COVID kind of started to get on our radar within the AAP, we immediately put together a COVID-19 staff group, which really includes staff from all aspects of the AAP, looking at our communications, our publication, our membership area, as well as our physician leaders and programmatic teams, and have been monitoring very quickly and in many different ways what information is coming to us. So we're relying really heavily on the guidance and expertise of our members of the AAP, and have put a couple of different things in place that has allowed us the opportunity to have some bidirectional learnings that really helps guide the content creation of what we are doing, our advocacy, and what we're doing with not only, you know, within the federal legislation, but also really communication. So what are we saying? What's our messages, and what are those outlets? And if you've been watching the news lately, hopefully you have seen Dr. Sally Goza, you know, sort of here, there, and everywhere, sharing the messages that is of concern to pediatricians, but also really children and their access to care. And then some policy. So we'll talk a little bit about some of the policy that we've been generating as well. The themes that we're hearing from our members really are coming to us from a number of different areas. One, we immediately launched a COVID-19 email address, and it's at the end of the slide. So any COVID-19 email questions that you have that we, you know, if after today you think of, we encourage you to email that, and that information gets vetted prior to being shared and responded to. We also instituted a discussion board that's open access, where we have a variety of pediatricians and their teams posting questions specific to telehealth. That is a huge theme right now. Well visits, and how do you ensure that children are still getting access to their doctor at a time when maybe their, you know, parents and others are afraid to go to the physician's office. So looking at that as well, and then making sure that vaccinations are still happening, because of course we want to be sure that we're not creating another sort of problem. So we can go to the next slide. This is the aap.org website, and we have right out the front of it our COVID information, and it really is information that we are updating on a very regular basis. We've developed some clinical guidance, so not like the typical AAP policy process where it takes, you know, a significant amount of time to develop, but really looking at what are the practical things that we need to share with members and the pediatric healthcare community with how to provide care to children and youth and adolescents in this unprecedented time. So we've developed some clinical guidance on specific to newborn screenings, as well as ambulatory care, where we're really looking at, making sure that kids and adolescents are getting the care they need, whether it be by going to the physician for their immunizations or leveraging telemedicine for part of the anticipatory guidance and others. We've been focusing a lot too on practice management, knowing that the primary care practices are seeing a drop in patients now in terms of the number that are being, the number of visits occurring. I think I've heard reports between 20% and 30% less visits are happening. And so that has implications for obviously the pediatric practice community. We've developed a number of resources for families as well, which we'll talk to on the next slide. Also advocacy. Physician wellness is really important now. It's always been important, but even more so now when we're thinking about burnout and the stresses of many of us are all facing as we're all working from home. Some of us are homeschooling our children. We never thought we would be doing that at the same time as working, and then all the other stressors that come about with that. So we have that as well. And then really looking at coding. So there's a lot changing in the coding and payment realm, particularly around telehealth. And so trying to stay on top of that and share that information with our members. We can go to the next slide. Thank you. Our parenting website is healthychildren.org. A number of new resources we've been adding to that. Again, this is in response to what we're seeing in the media, what we're hearing from our members, and what we're hearing from families. So really looking at parenting, kind of getting to the working and learning. How do you as a parent work from home, but also take care of your children, making social distancing a priority. Also a lot of information on mask use for children and what are the recommendations for that. And this is all done really hand in hand with CDC, making sure that we're amplifying messages there. And then other things like breastfeeding, co-parenting, adolescent care, how to keep kids entertained, all of those tips as well. We also have been really focusing on amplifying the message to families that it is okay to go to the doctor. It is okay to call your pediatrician. They want to see you, they want to hear from you, and they still want to know, want you to know that they're a resource to families for a number of reasons. Next slide, please. One of the programs that we launched pretty immediately actually was our AAP COVID Echo. And that really was an effort to not only bring experts in infectious disease, emergency medicine, and others together with those in practice, not only primary care, but we have a significant number of hospitalists and subspecialists who are participating in our echoes. We had an incredible amount of interest. And so we're reaching now about 900 providers over the course of about 20 different echo cohorts. And really it's serving as a really nice mentorship forum. So really looking at this from a way of bidirectional communication. So we're learning what's happening out in the communities with our members. They're learning from the experts on how to handle some of these situations that are occurring, but also there's this pretty nice relationship building that's happening on these sessions where people are supporting each other, both on the sessions, but also off via email. And so these will continue and have been quite successful. And we are continuing to develop content for those echo sessions. Next slide, please. So we're highlighting a few resources that that we're thinking would be helpful for you all. Of course, there's others, but really wanted to highlight a few areas. One really being telehealth, knowing that this has rapidly expanded. I think we did a periodic survey at the AAP a few years back where we found that 15% of our members were doing telehealth. And I would venture to say that the other 85% are learning, within the last few weeks here. So there's a lot going on in this space, not only with regards to regulations, but also really with regards to payment. And payment parity is what we're really hoping for, is to be sure that those who are providing care via telemedicine are getting the same payment that they would in an in-person visit. And so we've got some work we're doing with the private payers as well as Medicaid and others to be sure that that is occurring so that children can still get their access to care. We have an online compendium that we've developed, and that really is how to do telehealth. It's sort of like our playbook with a lot of resources and templates in there that folks are able to use. And then coding, of course, is changing. There are some COVID-19 specific codes. And then, of course, that all also varies by payer. So we're tracking that, and that is available on our website as well. We also have information. We've done webinars, one on caring for children with complex medical conditions, and a number of other webinars, but wanted to highlight this one in particular, as well as information on healthychildren.org, which is for families. We have done a webinar as well on resilience in stressful times. We are doing a webinar today on mental health, and we can, of course, share all of those resources as well as these slides with you all after today's discussion. And then again, you know, I talked about ECHO on the last slide, but coming soon, we're working with this team to launch a COVID ECHO specific to children with medical complexity. So we'll have more to come on that, but wanted just to highlight that here as well. Next slide, please. In process. So I talked a little bit about some guidance that we've developed, particularly regarding breastfeeding, ambulatory care, newborn guidance, and telehealth. But we're also working on other guidance that's specific to school reentry. So not really at this point knowing when that will be, but some considerations for what to be considered before kids go back to school. We're also developing content on health equity and mental health. These are two big areas where we continue to add to our content on aap.org, and are looking at this from a number of different ways. You know, we've got our information for families, which is our one arm of communication. We have our information for providers, which is our other arm, and then really the media. So as I mentioned, our AAP president has been doing a number of media tours. They're all virtual, of course, but those are happening quite regularly. And I think there are a number of issues that she's able to raise to the level of you know, the mainstream media as well as local media outlets. So those are sort of what we have in the works. And that's just this week. So, I mean, I think every week, you know, the group meets every day, and we're prioritizing based on what we're hearing and what we know our members are looking for. Next slide, please. So this is just the email address I referenced a little bit earlier, and then the website for all of our information. That'll give you a link to everything that I've shared in this presentation, but also we'll give you a link to the parent information as well. And I don't know if you want to do questions now or if we should wait. Yeah, okay.
I think that I just would like to do a check and see if anyone had any questions at this point. Anything you might want to ask offhand in relation to what they're hearing at the AAP. They have a response team that has been taking questions that come in nationally from their membership related to COVID-19. And as you'll see from Dennis's slide, Dennis and they've been also feeding back into that response team and helping provide support for children with medical complexities. So if anyone has any questions now, we'll take them. Otherwise, we can keep going and move into what Dennis has to share. And as Tricia said, we'll make sure we're following up with all of these resources for people to have at their fingertips.
It looks like we're getting Deb on as well. I don't see her audio, but she is just logged in. So she should be in shortly.
Great, thanks.
Tricia, I had a quick question. I'm wondering, this email address, is that primarily for questions about clinical care, or is that for any kind of question to do with the health of a child?
It is anything COVID related. We are encouraging to go there, and we've routed approximately 1,000 emails over the last several weeks. And I think the themes are pretty consistent with what I shared at the beginning, really telehealth, PPE, and clinical care.
Great, thank you.
Mm-hmm. Thank you.
Thank you.
All right. Deb, I don't know if you can hear us, but we wanted to just let you know that Tricia gave the presentation, did a wonderful job. And we're just about to transition into Dennis's slides. If you had any words of wisdom that you wanted to share with us though, before we do that, I don't want to put you on the spot.
No, just thank you so much for inviting the Academy of Pediatrics to your meeting and to hear what questions and concerns that you all have, because that will help, as I'm sure Trish said, help us try to formulate what we need to be doing in response to support all of you. And thank you, Trish, so much for filling in. And I truly apologize for getting caught up in another meeting. I apologize, but more than happy to entertain questions after our great colleague Dennis has a chance to speak. So thanks so much.
Great. Thank you very much. We really appreciate the time that both you and Tricia have given us today. So, and I think there's no one on the webinar today who can't commensurate with time crunch and meetings that run over and back to back ping-ponging between different priorities. So let's go ahead, and if I can get the slide to change, there we go. Let's go ahead and turn it over to Dennis Quo now. Thank you, Dennis.
Ooh.
Just
Okay.
unmuted you, Dennis.
Okay, can you hear me?
Mhm.
All right, excellent. Hey, everybody, I'm Dennis Quo. My day job, as I like to put it, is I'm a general pediatrician. I lead the faculty general pediatrics division at the University of Buffalo. My practice at Oshai Children's Hospital focuses on children with disabilities and medical complexity. The vast majority of our visits have moved over to telemedicine in response to the COVID complex. And I think it's actually a lot of opportunities there as well that we're seeing. I am the chairperson of the Council on Children with Disabilities. And I'll just give some updates on what we are doing from the council standpoint. We want to be a resource for folks. I just asked for next slide. Or do I advance, or are you all doing it for me? Okay, cool. The Council on Children with Disabilities is just to give you some information for those who may not be familiar with the group. We are a multidisciplinary group with about over 650 members. It includes general pediatricians, DSA specialists, and trainees. We have also liaison relationships with organizations that are involved with the CoIIN. That includes Family Voices, it includes the Maternal and Child Health Bureau, the Centers for Disease Control and Prevention, and internal to the AAP, we also work very closely with partnerships with the sections on developmental behavioral pediatrics, the section of home care, and the section of pediatric trainings, among others. Now, as a group, we're multidisciplinary. I mean, our focus is the children with disabilities and medical complexity. And we focus on policies, many of which we write, and others we collaborate with other groups. We have a very strong program on education of members. We engage a lot of our memberships regarding, in particular, our early career physicians and our pediatric trainees who are interested in careers of taking care of children with disabilities and medical complexity. And then we also have a very strong advocacy focus, focusing on policies, focusing on and collaborating with our colleagues at Washington and at the state level. So as I said, we have a very strong interest in children with medical complexity. That includes the clinical care of such children, the systems of care, and the role of the medical home. Next slide. Some of the relevant policies that we've written in the last few years. We have a policy on the recognition and management of medical complexity, a policy on the out-of-home placement of children and adolescents with disabilities and medical complexity, and the home care of children and youth with complex care needs and technologies dependence. We also have hosted a number of webinars on the topic of children with medical complexity. This is something that we've been really ramping up in the last few years. We, of course, sponsor a number of AAP national conference sessions on this topic. We also offer mentorship opportunities for those who are interested in pursuing a career in caring for children with medical complexity. So we offer virtual office hours. We also support with a scholarship program the attendance of trainees and early career physicians. And also, as I mentioned earlier, we do a lot of advocacy with the state and federal advocacy team. Next slide. So in the last few weeks, we at the executive committee, members of the Council on Children with Disabilities, we have engaged within ourselves and also with our members on what are the relevant topics that folks are seeing. Our last meeting, which happened a couple of weeks ago, we really framed a number of discussion points, and I wanted to share these with you. I'm sure that a number of these will be immediately recognizable. The first listed here is telehealth care. Discussions about how to conduct a telehealth care visit for a child with medical complexity, how to ensure that we have equitable access to services for vulnerable and marginalized families and communities. Families that, there's an access difference when you have a good, reliable Wi-Fi connection and a laptop versus you don't. You might have a data plan with a phone, or you might not have a data plan. And then also the appropriate coding and payment, particularly across state lines. Second point we've raised was the issues of having enough supplies, including durable medical equipment, PPE, and medications. There are also some growing concerns about the rationing of certain things like ventilators for children with medical complexity. And our work is ensuring that we have equity and access to life-saving medical equipment, and that there's no discrimination against children with medical complexity or disabilities. Next slide. The third thing we discussed was really the topic of home care and therapies. Issues related to the continuity of home health care services for children with medical complexity. We have a lot of children that we take care of who rely on home care, whether it's a visiting nurse, it might be a home health aide, might be therapists who come visit in a home setting. What are the potential exposure risks versus the benefits, and a continuation of therapies in accordance with the individual education plan. The next topic we've discussed is the roles of families and caregivers, particularly during the COVID pandemic. Some very specific questions have been working on the supporting family presence in a hospital setting, particularly for children with disabilities and medical complexity, particularly as needed for American Disabilities Act accommodations. We're finding some concerns about limiting family presence for infection control purposes, and they're important, obviously very, very important, but we have to make sure that the needs of children with medical complexity are met. We've also faced topics on family and caregiver wellness, coping resilience during this time, and also a lot of discussion about what happens if a caregiver becomes ill, particularly with COVID. Next slide. The next topic is the issue of mental health, the importance of supports and services for families, caregivers of children, and the children themselves, and as well as physician wellness and mental health support. The topic of education, the education for children, with many schools moving to e-learning and distance learning, we've looked at concerns of continuing special education services for children, particularly with IEPs or under Section 504, and being able to maintain special education services and therapies within this context, whether it is teletherapy or providing the parent with packets and following up by phone. Just how do we maintain those services? Next slide. So with those topics, the Council is collaborating very closely with the centralized AAP COVID-19 response team, really to inform these activities related to children with special healthcare needs and disabilities and medical complexity. We're sharing on-the-ground observations, and we are taking those observations and feedback and providing our weekly updates regarding the COVID-19 activities to our members through our weekly newsletter. We have published and developed a number of educational sessions and publications. We developed a 20-minute recorded webinar for caring for children with medical complexity during COVID-19 that was hosted by Dr. Liz Lucas from Nationwide Children's in Ohio, in Columbus, Ohio. And a healthychildren.org article, COVID-19 Information for Families of Children with Use of Special Healthcare Needs. Kara Coleman, who is our liaison for Family Voices, and I were the co-authors of that. Next slide. We're also providing our expertise in addressing certain questions posed to the AAP COVID-19 response team. And many of these revolve around existing policies that our council owns. So one, for example, is the continuation of developmental surveillance and screening during the pandemic, particularly if there are restrictions, whether they're imposed by the office setting or community restrictions, or whether families are not coming in because they're afraid to leave the house, and how to continue developmental surveillance and screening in that context. As I mentioned earlier, family presence policies for children hospitalized, the issues of home visitation for children with medical complexity, and this is something we're doing in collaboration with the Section of Home Care. We, of course, answer a number of media requests with working with the AAP Public Affairs Office, and we're also been collaborating, as I mentioned, with the state and federal advocacy teams. Next slide. So in summary, we're really trying to get the word out as much as possible. We've got a lot of requests basically saying, what does the Council on Children with Disabilities, what are the resources, what are the tools, how do we take care of our children with disabilities and medical complexity? So over the next few months, our plan is to really engage our members and the AAP's wider audience as much as possible with articles, collaborating with the media, producing webinars, working with state chapters and teams, and as previously mentioned, just our collaborations with other AAP groups. So next slide, I think that's it. I want to mention and give a shout out to Alex Kuznetsov, who is our manager for the council, very instrumental main contact for us and keeps us all in line. So shout out to her. And that's my presentation. Happy to take questions, and hopefully this gives you some things to think about as well.
Thank you, Dennis. I also want to mention that Dennis is a very engaged member on our National Advisory Committee. We're very grateful for that, for the CMC CoIIN. So this was just a little bit of a frame, an understanding of from the AAP perspective, what they've been fielding, what they're producing, the way they're being responsive in the context of that for children with medical complexity as well. And obviously, with all that they're hearing, it's a great time for anyone that has anything they want to bring up for what you're doing right now and what you need to talk about. We'd really like to open it up for anything that that is going on. So we don't have an actual slide for that, Meg. So we're not going to wrap up the next step. So we'll just leave it right here for now. We didn't think of a slide for the moment of discussion because we thought we could just dive right in. So I would open it up to anyone who would like to take this opportunity, throw into chat anything you'd like to offer. I'd also like to, so go right ahead and let's see if anyone has anything they'd like to say at this moment in time. You can also just unmute yourself and feel free to speak as well.
Evelyn, I stopped sharing my screen so we could see one another better.
Yeah.
And if folks want to take themselves off their cameras so we can see their faces, that would be lovely too, but we understand. Some people are shy.
The other thing that's helpful here is you'll see, hi Rhonda, with the AAP, they are very interested to hear what you're experiencing as well. I think that will be very useful for them to understand as well. So we'd love for folks to show us their beautiful faces so we can interact with each other. And we do have some folks on the call that National Advisory Committee members that we've been engaging around considerations around systems issues. So we're talking family perspective here, we're talking clinical perspective, we're talking systems issues people are considering right now, just laying it all out there because if nothing else, it will help us for moving forward as well.
So this is Deborah from AAP, and thank you so much for inviting us to be part of this conversation. And I know that Trish may have mentioned it a little bit in her presentation, and I know that Dennis highlighted it. We'd really like to know about the challenges that people are maybe facing in children accessing specific therapies that may be novel or innovative in terms of delivering them through telehealth. So in terms of services, occupational therapy, physical therapy, speech therapy, ABA, anything specific that our colleagues out there want to bring up to us, suggestions that they may have on things that we may want to do in terms of some advocacy or support or develop resources. I'd love to hear anything in that space. And then, as Dennis pointed out, the other space we're really concerned about is being able to access some of the durable medical equipment, medications, as well as things that you would hope there would not be challenges, but obviously your groups may be experiencing. So those two different things, if anyone wants to comment, we'd appreciate it.
Deborah, this is Marie Mann. Could I add one more question to those online?
Sure.
Is potentially if anyone has have had a successful or some good a good remedy for the care of children and youth in the home when the caregiver becomes ill. I know that there seems to be some issue, particularly when there's like a single caregiver. So if anybody has some good tips on that and can share, that would be great.
Thanks, Marie. That's a great point.
Yeah. Hey, everybody, it's Chris Stilla. I don't have a ton to add, but just a couple of thoughts about the questions, the last 2 or 3 questions. First of all, in terms of Marie's question, I don't think anybody has a great answer. It's really, expanding your safety net as much as you can while trying to keep everybody safe at the same time, which is really like walking a tightrope that might be even too thin to walk on sometimes. So I don't have a good answer there. I do have some experiences from families of kids with complex needs and just a little bit of information about what home care services seem to be less problematic versus more. Families that can access some kind of telephone or telehealth thing and have home care and therapists that are willing to be creative in what they do seem to be maintaining their services. And some of them are maintaining them very well, especially because sometimes kids that come into a center for services are now being seen in their home environment, and so there's more information to be had there, which is really good. The kids that I worry more about are the kids whose families may not necessarily speak English. They seem to be losing their services more, and their families don't know, they may not have, like Dennis said, they may not have a good data plan or a good way to do telehealth type things. And so I think the more we can work with those populations so they can self-advocate and for their home care agencies so they can try and connect with their families in any creative way they can. I think that's pretty much it from my experience so far. The other thing, which kind of is a little bit off topic, but we're starting to have increasing problems with getting kids into what we feel is a very safe space for well visits and vaccines and stuff. And so I think it's really important to message that we are still very invested in taking care of kids, that the kids need that care, regardless of what creative model we decide. But I'm more worried about that than anything else in the months to come.
Thank you, Chris, for those comments. We were writing furiously to just track those because again, we want. No, you weren't. And if you want to send us well, actually, I shouldn't be presumptuous, but if you'd like to send us a message offline, we'd love to follow up on those things as we build out resources for the Academy. So thank you for that.
Hi, this is Debbie. Can I talk about the home care aspect of things?
Please do.
I'm sorry for my appearance. I've been wearing pajamas for like 5 days.
And who has not? Raise your hand if you have not been wearing pajamas for 5 days.
And I haven't even combed my hair yet.
Good anyway, for you.
And I'm in my son's room, so that's why I have this mask on. But I just wanted to talk about the home care aspect of things. So for us, physical therapy, we had it in our home like once a week, and she actually had to suspend her services because she was seeing multiple clients. So she said she'd suspend services for a couple of weeks, but then we had our shelter in place order. So she hasn't, of course, come back. So that stopped. And then also for respiratory therapy, they typically come in to check the ventilator. But instead now they sent a modem to the home, and I'll kind of show you. Wait a second. So here they just, wait a minute. No, I don't know if you can see it or not, but they just sent a modem, and the modem just talks to the respiratory therapist, and then that gives the information they need, and then then they forgo the visit. And then if you have any other trouble, like you need some troubleshooting, you can talk to them on the phone. So that takes care of that contact visit. But we are having trouble as far as like supplies, like disposable supplies. So it's kind of interesting to me how like on television they talk about the need for ventilators, and that's all they say, ventilators, but they don't talk about all the circuitry and the connectors and the heated wires and whatever, and all the companies that need to be involved in making those things. So we did get a call from our respiratory company to say that rather than like changing out our circuitry once a week, to keep it clean, we need to go to once every 2 weeks, and then possibly once a month, because they weren't able to keep up on the demand. And so we have to do that. And then as well, like gloves, so we have to use gloves for everything essentially. And you can't cross-contaminate when doing cares, like for gastrostomy cares and trach cares and so forth. And also the nursing staff, they have to use gloves, like for doing, like changing for incontinence and so forth. So we've been told now we can only get 3 boxes of gloves per month now, because everything is actually being, deferred to the front line. So yeah, it's happening that, home care is kind of like being pushed down on the list as far as priority for supplies. So they said to like save everything you can, and if possible, to go to clean technique instead of sterile technique with suctioning, because I guess that's next is suction catheters. So yeah, we're being affected too. Also for nursing care, we had trained in a nurse who was supposed to start at the end of March, but because he worked at a major hospital here that has a COVID unit, and he also worked at a long-term care facility, we couldn't allow him to start. And then we have 2 nurses who work just with our son as a client, so we allowed them to stay. We had family members coming in to help with other hours because we have to do 24/7. And then we had one to just stop working just because we had to kind of control how much exposure our son had. So we're kind of whittled things down to the bare bones, and just kind of surviving on that, as well as making up our own disinfectant and trying to get spray bottles off of Amazon, which is really difficult because everybody's purchased them. I found some for $20 that are made out of glass because nobody thought of that yet. And so we've been doing that and just trying to be resourceful where we can to make this all work. So yeah. Here's Joshy. You can say hi to him. Say hi, Josh. Oh, I don't know where he went. Oh, sorry. Wait a minute. Wait a minute.
You can't tease us like that.
Sorry. I don't know where he went. Oh, wait a minute. Okay, here you go. Here he is.
Hi, Johnny. I imagine there are others that are experiencing something very similar to what Debbie is speaking to. That sounds, and it's very good to hear that in real terms and how it's happening in your household and what you're experiencing. And I'm going to read, I've been just throwing into chat so that people can peruse and see if anything else comes to mind for you, but I wanted to mention some things that did come into chat in the meantime. Thank you very much, Debbie, for sharing that. So we have here, I'm going to start from up where we were. So Sarah, you said, I've not found that any of my Latino patients have maintained their early intervention therapies, yet the service provider keeps sending out information to us that they are still available. In our group, we're doing most of our telehealth by audio to accommodate our families. Are the early intervention services allowed, paid to communicate and serve families by audio? Does anyone know the answer to that?
So this is Deborah. That's a good question. From the AAP's perspective, I don't know if we have an answer to that specifically, but we're more than happy to look into that. We are right now presently working with some of the payers to try to figure out what is being paid through telehealth, at least for physicians and nurse practitioners. But it's important to recognize that there are others in the field that also need to have their services reimbursed when they're conducted through telehealth. And we'd be more than happy to see if we could find any information out and provide it back to Meg and Bethlen.
That would be great, Deborah. State Medicaid programs have always had a lot of leeway, a lot of discretion in how they design telehealth reimbursement strategies. There aren't a lot of things that you have to formally ask permission of CMS for, but there's so much variability between the states about how they've organized that and then how they've adapted to COVID-19. So I think this would probably be something that would be happening on a state-by-state basis as opposed to federally or nationally, but we would welcome that kind of information. I think that could be enormously helpful. Thanks.
Sure. And I'm just thinking out loud here, and I don't know the answer to anyone on the, I'm wondering if those individuals and services that are being provided through early intervention programs, since there's probably a different mechanism where they get reimbursed, if there's anyone on the call that could talk to that piece at all, or we're more than happy to follow up and see if we can find out any information.
So early intervention comes through Part C, education funding, as opposed to the healthcare system. But
right.
there are states that have mandated benefits where if a child has private insurance and those services would be covered by the private insurance, then the early intervention program can bill the private insurance. So again, it's state specific in some ways. I think that, this is another example. I'm not going to get on my soapbox, I promise. Just 2 seconds. This is another example of how many silos there are that families deal with every day that now are becoming even more apparent to a broader audience of stakeholders in how things are broken apart, how things are siloed, and the things that were previously gaps that individual families faced are now chasms that a population of families are facing. Okay, thank you for coming to my TED Talk. I'm climbing off now.
You're talking to the we all, yes.
Reach into the
all
choir.
you say is yes and nod our head. Yes and nod our heads.
All right, great. It's very important at this point. What we're doing is that we can at least even if it's just for identifying areas where we can try to get more answers and feed that back to everyone. That's going to be just as important right now. That bidirectional learning, as we're talking about. Holly Henry posted an article on the topic of ventilator supplies that was published yesterday. So that's also in the chat. We will be feeding that back and follow up to everyone, but you'll see that there. And then, so Christopher Stilla did say that they don't know if they're paid, but some of their families are communicating with their therapists by phone. So that may be one group that is able to get payment because via audio as opposed to having the video. So that's a good consideration when looking at policies and seeing where they might be able to get reimbursement. And then Elaine Gabovich says, hello, glad to see issues RA family presence in hospital settings, planning for caregiver illness, home visitation, equity and access to events, PPE, meds, etc. At the Massachusetts DPA's Title V, CISHWN are hearing about these needs in and working on many of these issues, some raised by advocacy groups and some raised up between multi-agency collaborations for partnership. Some have already been addressed at the systems level over time, some are in process, haven't been addressed. Also hearing a lot about families who don't speak English and not seeking services themselves due to fear. They may be recently unemployed as well. So caring for their family, their child with medical complexity, and having COVID and no resources for the essentials. So that's some of the key concerns that they're experiencing. Anyone else want to add to that or second that or add anything new? Or anything that they've seen ways they've been able to consider. You speak here about what you've been doing, Elaine, to try to address some of that. Do you have any promising practices or things you'd like to share that might be useful for the group to hear? I'm not sure if you're able to unmute or if there's something you'd want to mention in chat. All right, we'll see if she's able to, if she has anything further she'd want to communicate. Okay, very good. So we've got a few other things going on. This is great to have all this. There's wondering about lack of interpreters available. I can only imagine that's part of the issue indeed. Ed Shore says, my daughter's a speech pathologist in Baltimore and she is being paid via telehealth. Yeah, so some families only do video because they don't have data plans to be able to do audio. And then Ed is asking about the telehealth affecting care coordination. Would anyone want to speak to how any experiences around how the pandemic and telehealth is affecting care coordination? I see that, Rhonda, you had something to say about that. And Marie N, wondering if you'd want to comment.
I don't know how it's impacting care coordination across the country. I did hear from Rich Antonelli they're actually using some of his tools very in some of the work in Massachusetts. I think in some of the communities where COVID is prevalent, I think in Lawrence are taking some work that they've already in place and then pivoting it toward addressing needs of COVID. So I think there is opportunity, and certainly I think going forward, right now we're focusing on how to get by, but we need to consider, and I think at the federal level, there's already a plan to think about, a recovery. And so it is sort of the long term. So actually, I think there's opportunity for some of our work to hopefully bubble up, and hopefully it would get sort of, I guess, for folks to see some of the work that's been, and hopefully we can scale up some of the work that's been done by many of you.
Thank you, Marie. You'll see there's been a bunch of activity in the chat. Anyone, you're also welcome to shout out a question. I'm going to keep going through here, but if someone else has something else they want to mention right now, there are a few questions in here as well. The MCOs in Kentucky are doing more case management with at-risk patients, including CMC for COVID. So they're contacting them weekly and connecting them to resources in Kentucky through the MCO. And Shreya had a question for if anyone has anything they'd want to speak to. Curious if receipt of preventive care covered under telehealth payment codes.
Oh, this is Deborah. Trish may want to answer. The Academy's been working on it, and Trish may want to chime in, or Meg. Trish, I think you're on mute still.
Here, I can unmute you. There you go. Whoops, I just muted you again, sorry. We did it at the same time.
We're playing here. Yeah, so great question. I think there's a couple of things. I did post in the chat a link to state-specific payments that are happening, and it does get to some behavioral health and some other services. So take a look at that. If you have questions, let me know. I can connect you to people who are at the Academy who are looking at state-by-state guidance. The telehealth area with regards to WellCare, there's been a lot of advocacy going around with our private payers, as well as the Medicaid agencies too. The Academy, and I'll share another link with you all after I finish talking, but we're looking really closely at what payers are covering, particularly to telehealth, and then also looking at individual payers and what codes they're asking to be used. And it varies, right? So it's not as easy as one code for all telehealth visits. That would make it way too easy for everybody. So not only do each of the payers have sort of their own preference on how this is coded, but we're also advocating really strongly that that payment is in parity with in-person visits, and that that also we're looking at that the full payment occurs for both visits. So not only the first, which would be telehealth, but then also the second, which would be in person, to cover the things like vaccines or anything that requires the physical touch. So I can share with you all a couple of links here so that you'll have access to it. And then maybe Bethlen can send it out via email afterwards. But we're updating that information often on the aap.org website. So, you know, continue to check that. But also, you know, you're certainly welcome to contact me, and I can get you in touch with the right folks.
Great. Thank you, Tricia.
And just, this is Marie. Just the resources is not specific to children, but certainly at HRSA, the Technical Assistance Center, the telehealth technical assistance centers, there's a lot of information, and particularly following the CARES Act with the funding. I think they're really generating a lot of resources. So that may be something for people, if they want more information about telehealth, can access.
Thank you, Marie. And Tricia just dropped in guidance on telehealth and ambulatory care. Dennis mentioned that New York is covering, most payers in Western New York are paying for preventative care through telehealth. And then Sarah Stelzner says, we have been asked by our health system to pilot care conferences by telehealth, partnering with our parent-to-parent organization about special kids. So they're starting to do that. And I do want to mention Steve Fenton had pointed out to us that the latest guidance from Medicaid, it does look like that they are including in payments. Steve, do you want to speak to that just so that we can make sure folks are aware of that? If we can get you off mute, want me to get you off mute? There you go.
I think I did it.
Yeah.
Well, I just read it yesterday. So, but we've been wondering for those families that might be struggling and, you know, socioeconomically disadvantaged and may not even have computers or the ability to afford transmission charges in their home, whether there'd be any possibility of that being paid for by insurance or especially by Medicaid. And they put out some guidance on telehealth, which includes some statements that lead strongly to conclude that that is an option that the state would have, but the state Medicaid agency would have to adopt that, but that the federal flexibility exists there. So I don't know how big a problem that is, or if most folks just, you know, have those capabilities. I'm imagining that at least there are a few that don't. But anyway, just throwing it out there.
Thanks, Steve. So we are actually at the end of our hour. I know that that's hard to believe. We're trying to do these much quicker so that we can get people back to whatever they may need, what else is pulling on their time. If there's anything else you'd like to know about or have questions about, please feel free to put it right into the chat so that we can make sure that we're including that and getting answers. I also, Meg put into chat, someone mentioned care coordination. It's a huge concern, and we do have some work in that area we're going to be moving forward in the CoIIN. Maybe we can move to the slide that just shows what, it's like our final slide that just shows what we have for activities right now with COVID-19 in relation to the CoIIN. If we can get that pick up, great, but, and then
have a wrap-up slide with all the little activities we're doing on it.
I'm trying to find the share button. Sorry, guys.
it can be elusive.
Oh my goodness. Like I said, so many permutations of joy that Zoom gives us. Okay.
Yeah, this is Ben. I'm the research assistant on the CoIIN. Most of you know me. We just wanted to highlight some of the activities we're doing in response to COVID-19 through the CMC CoIIN. So you can see those on the screen. You can also read about most of them in either our newsletter, or also we're sending out a communication to the state team leads probably today, and that'll have more information on that. Just to highlight, this is the first of what we're trying to do as a series of pop-up webinars. So if you could please fill out the evaluation that Libby has just dropped in the chat box there, that'll be really helpful for us, so we can know what went well, what could be improved, and then really what you want to see coming from these webinars moving forward. So that would be very helpful for us. Thank you. And then, as we heard, I think Trish said, we're starting the Echo. So we're hoping to launch that at the beginning of May, and you should be hearing next week about recruitment for that as well.
And Meg, do you want to mention the Care Coordination Academy, just since that came up in this call?
Oh yeah.
Oh, sure. So we've been working with Rich Antonelli and his colleagues at the National Center for Care Coordination Technical Assistance to not only offer you all some intensive technical assistance around care coordination itself, but we've also been working on pivoting and tweaking some of both the curriculum, but most especially the measurement tools around that, to be responsive to the era of COVID-19. And you'll be hearing more about that in the coming weeks as well. But we're very excited about that opportunity to be able to help you all, not only from a practical standpoint in your care coordination activities, but also to help you measure meaningful outcomes associated with your care coordination activities, and therefore be able to make a better case around the value of care coordination activities for your payer community.
Meg?
Yes.
Do you want to say something about the telehealth measure and the conversation we had the other day with it was just a small group of CoIINers, or CoIIN folks?
That's right. And I'm thrilled to say that it was people from the state teams who told us to do this. It's not us making you guys do one more thing. This actually came from the states. There was a suggestion that in the context of all the measurement that we're trying to do around the family and staff experience of everybody's individual quality improvement project, it would probably make sense to layer an additional 3-4 questions at the most into some kind of mechanism to get a sense from families about their experience of telehealth in the context of the quality improvement projects. And we'd also be talking to the staff around their experience of providing healthcare through telehealth. And so we think this is an opportunity to capture what's happening on the ground for the states, for the kids and families and clinicians, but also to help build some more evidence for why we shouldn't go back to business as usual with telehealth after all of this is over, that there are actually some things that would probably be good to continue. And we'll be able to have some data around that. It's a small N, but it could be really meaningful. So thanks, that was a good cue, thank you.
Okay. So I think that's what we got. If there's anyone that has a last burning comment, question, anything they need to say, I know some folks are going to need to hop off, but you're more than welcome to mention anything else that you'd like to while we still have some folks on the line. All right. Well, thank you.
Speakers. Thank you very much to those who took an hour out of their day to join us. And we'll look forward to staying in touch. Please keep those ideas coming to us. We really appreciate them.
Yeah, we'll do whatever we can to support along the way, and everyone be well, stay safe, strong, and find those little moments of joy along the way, and keep up the good work.
Thank you all. Take care.
I'll keep it open for a couple minutes just so you can access the survey link.
And you can find that in the chat again if you need that.
Team, I have a 3 o'clock. I'm going to hop off. I will check in with you all again later. Well done. Thank you all so much.
Thanks, Meg.